Welcome to this special edition of Real Talk with Robert Simmons, where we go into the medical field. And today, we are talking feet. That's right, feet. Did you know that 75% of Americans at some point in their life will have a foot problem? And that women are 4 times more likely than men to have a foot issue? I was wondering the same thing. I had no idea that feet were this important. But today, we have one of the top podiatrists in the country. In fact, he is considered to be in the top 100. He's been in practice for over 54 years. And his name is no other than Dr. Horowitz. Well, thank you for seeing me today, Dr. Horowitz.
Thank you for coming.
I had no idea how important feet are to the American society. In fact, as a podiatrist, how important is feet when it comes to health?
Well, of course, being a podiatrist, it's very important for my profession, but more important is the idea that this is one of the least taken care of parts of the human body, and yet one of the most important parts of the human body. And especially in the Afro-American community, where diabetes is one of the major problems that the community is seeing, and that foot conditions, and specifically foot infections, are the main reason that diabetics are put into the hospital. The statistics are even more scary when you think about 90%, 90,000 amputations every year take place in the diabetic community. And a great number of them, matter of fact, a great majority of them are Afro-American patients, which is even a worse statistic when the U.S. government has stated that 85% of these amputations would never take place if basic foot examinations took place before that, and basic little foot problems were taken care of before they became what we have to say are nightmares leading to amputations.
Wow, that's incredible. Earlier,
now you understand about foot problems.
I'm beginning to see it more. I read a statistic earlier that 75% of Americans at some point in their life will have foot problems.
I hate to disagree with you. I will tell you 100% of all Americans, and no matter if they reach the age of 50, will have foot problems. Depending upon the degree is different, but there's practically no person alive today that doesn't have some form of foot problems due to many factors. Due to environment, we're never meant to walk on this type of surface, hard grounds. Due to heredity, the shape of bone structures and everything. Due to I have to tell my female patients, shoe problems in many cases.
I'm glad you mentioned female patients, because there's a statistic out that says women are 4 times more likely to have feet problems than men. Is that?
Well, there's another interesting statistic that I have to favor the female with. Yes, females have more foot problems only because more females will end up going to a foot doctor than the males do. But males have a lot of foot problems due mostly to occupation.
Wow.
I mean, standing on their feet all day long, jumping, doing things, sports, all lead to foot problems. The worst problem is we don't understand, so bends the twig, so grows the tree. We don't understand that children's feet should be taken care of. And today, we put children into sneakers and everything under the sun because they want to be adults when they're 2 years old. You know, the parents want them to look like adults. And in many cases, this causes problems because we don't take care of our feet. The other problem that comes into play is one of the great medical problems we're having is obesity. These children are heavy, their feet don't form correctly because they're bouncing on these sidewalks that don't give, their extra weight is on there, and that causes bone structures to change. And that goes on through a lifetime. The trouble is most teenagers don't care about their feet. They don't care if they hurt. You can only look at what they wear besides shoes, and you understand the emotions behind teenagers. By the time they reach 30, they say, "Oh, my feet start to hurt." By the time they reach 50, they say, "My feet are killing me." You know,
wow.
There's a big difference, and it all starts many times with children. If we could control the child's foot, we would have much better feet as adults. If we could control the teenagers, we'd be better feet. If we could control them when they're 20 and 30, we got a fighting chance. By 30, 40, and 50, the chance is over that we can stop something. From that point, we got to try to correct what damage has been done.
So it sounds like what you're saying is prevention.
Yes.
Is key.
Yeah, the door to everything that stops everything from going bad to worse is prevention. And the key to prevention is examinations.
Okay.
You can almost, I give lectures many times on diabetic feet especially, and I always ask the question, if I have 20 people in my seminar audience, I say, how many people have had their feet examined? And out of the 20, I'm lucky to get 3. I ask how many have had their eyes examined, everybody's hand goes up. Their teeth examined, their ears examined, and every other part of their body, but their feet aren't examined. And then the 3 that say yes, I say, well, let me tell you what makes up a foot examination. And I ask, did you ever have that? The hands go down.
Wow.
So actually, that's the great tragedy for prevention. Very few people come in to have their feet examined. They come in when they got a condition, which is late, not early, especially with the diabetics. Especially with the diabetics.
Is the diabetic foot the most? I mean, do you see that more than any other problem when it comes to feet?
Well, it's not the diabetic per se, it's the diabetic foot problem.
Right.
We see
right.
poor circulation, we see ulcers, we see infections, we see all kind of things that become much more important or much more of a problem being a diabetic because of the lack of circulation, because of the lack of feeling that many diabetics have called neuropathy. And they could actually, I've had patients literally come in, say, you know, the bottom of my foot feels funny. I look at the bone is sticking out the bottom of their foot, and they didn't even know it because they have no sense of feeling on the bottom of a foot. They could walk on fire and not know they're walking on fire. That's how bad sometimes neuropathy gets. Wow. And you've got to, your eyes have to be a part of your feet, your nose to smell infections, everything. And most important, you have to have your feet examined.
Wow. Well, this being February and it's Black History Month, what would you tell the African American viewers of how much more important it is? Because it seems to be very important when it comes to...
Excuse me. My biggest headache has been the acceptancy. Mm-hmm. I ran the city clinic here in Jacksonville, diabetic clinic for almost 12 years. And what bothered me the most was the acceptancy of foot problems. Not trying to control it, not trying to stop it, but so I've got it. That attitude has to come to an end. We've got to realize that feet are very important because the statistic is if you lose one leg, the chance of you losing the second leg in 5 years is 50 to 60%. The chance you won't be here in 5 or 6 years is also 50 or 60% if you lose one leg. Remember what I said, 85% of the people that lost legs wouldn't have lost it if they would have had their feet examined and taken care of the basic foot problems. So we got to change the mental attitude that this is a problem and you have to take care of it. And for just the sake of understanding what a foot examination includes, it includes we look into the circulation of the foot. We want to know how much blood is getting there and how much blood is going back. Swollen feet are a problem. We want to know if you feel anything, if you got burning, tingling, numbness. We also want to know if you got foot deformities such as bunions, hammered toes, ingrown toenails. We want to know all these things. We want to know all these things about how your foot functions. All these things are tested. We put you on computers to measure the way your weight goes through your foot so we can make something to stop the weight going through your foot improperly so you don't put pressure to cause an ulcer to form. Wow. All these things make up a foot examination. X-rays are taken so we know what the bone structure is. Then we will sit down with you and go over how we can stop all these things or protect you from these conditions getting worse. The earlier you have a foot examination, the better chance you have of not having problems. And diabetes itself is hard to control. If your sugar isn't under control, it affects your feet. The feet are some of the first things that, when kidneys go bad, the feet start to swell. First signs of kidney problems can be a foot problem. First signs of heart problems, the pains when you're walking and everything indicate poor circulation, could indicate heart problems. The foot is a mirror of many other conditions.
Yeah, I believe that. I went somewhere and I saw a little sock, and at the bottom of that sock it had different organs of the body.
Well, that's getting a little beyond normal scientific evidence. That's reflexology, and it may have a place, but not necessarily when we're trying to prevent a lot of these conditions from happening. The most important thing, if I could ever stress this, is to have your feet examined, and not examined once. The saying is, if you had a tooth that's bad and they fixed it, wouldn't you go back to the dentist again to have your teeth checked? I have, if I do a surgery on a patient, fix their bunion, they don't come back for 4 or 5 years. They say, well, you fixed my bunion. I said, there are many other things. There's 26 bones in each foot. Other things can go wrong other than just that one joint.
Right.
And we have many conditions involved with the foot. We see gout where the foot swells up and everything. And that's a foot problem that we see in every community. And it is very much associated with obesity, too.
Okay.
So these are conditions that, so many conditions that the people have. Poor circulation, nerve problems, injuries. I mean, injuries galore because of the foot. What other part of your body takes more abuse than the human foot? I mean, you're on it all day long. You walk 7.5 miles a day. 4 times your body's weight goes through your foot every single step you take.
Wow. I had no idea, and I'm learning as well as the viewers here. So quote me if I'm right. You have a program where you are running free foot screenings.
We will do free foot screenings, but in essence, we have to tell patients, because it's a state law, we can't treat you after we screen you for at least 48 hours, even if you have an infection. Even more important than that is most insurances, including Medicare, will pay for a foot examination, especially for the diabetic, because we're trying to cut down the high-risk patient. The high-risk patient is economically costing everybody a fortune, literally, because infections in the hospital, in and out. If we can stop those things, we not only help the patient, we help keep costs down for the economy and keep insurance costs down. The more people spend, the higher the insurance rates go. The keeping people out of hospitals keeps costs down. We can lower insurance rates, keep people happier. That all starts from prevention. And prevention is the key to foot problems, especially in the diabetic community and especially in the Afro-American community.
Wow. Well, you guys, you heard it here with Dr. Horowitz. Once again, he's been a podiatrist over 54 years.
No, just 54 years.
Just
don't make it worse.
Just 54 years. And like I said in the beginning of the program, you were rated in the top 100 in the country. So I believe that he knows what he's talking about. And I want to thank everyone for watching this special edition. Dr. Horowitz, I want to thank you for...
Thank you very much for having us, and keep walking.
Thank you very much. You guys stay tuned.